Nurses are perceived differently by everyone, and I want to know your opinion on nursing. So, with that being said, if you could summarize your image of nursing in one word, what would it be and why?
Caretaker.
And why?
Because I think nurses have to be prone to
As a calling?
yes, to be caretakers and um, to have the feelings, to make that person
Serve.
feel safe
And willingness to serve.
yeah, mm-hmm. Willingness to serve. Um,
Okay. How often do you experience the hospital setting, and would it be on an emergency basis or more of a follow-up inpatient?
uh, Both. I experience emergency room visits several times in the last year. I've been admitted inpatient 3 times. And then I have follow-up appointments with doctors and maybe CAT scans and stuff like that.
What is the main issue that you're dealing with when you go into the hospital? As in, why are you going to the hospital? Your main one.
Well, I have lung problems, rheumatoid arthritis, discoid lupus, and possible muscle nerve damage that I'm going to be checked for.
Tell us how an interaction in the past with a nurse has made a difference in your life.
Well, I worked with nurses
Mm-hmm.
in a nursing home, and I was just really amazed at the patience they have with them and the care they give them, and day after day and year after year. I think they really have to have a calling.
Mm-hmm. And did you have anything yourself when you were as a patient?
Yes, I had my nurses were very good. There was one that was not, the bedside manner was coarse and loud, and she was not very good at IVs, and occasionally I guess you get a nurse that's there for the wrong reasons. Actually, I think she was.
Did you have any positive?
Oh yes, especially the last time I was there. They always come around and ask you to rate the nurses and to give any bad reports on them. And I said, well, you must put the fear of God in these nurses because they've all been excellent, and they were. And they went way out of their way for me. And I mean, it was a great experience.
You were telling me earlier that a nurse stood up for you in one of your past visits to an actual doctor.
Yes, I became short of breath and was coughing up blood, and they called the ambulance to me, and they got me into the emergency room, and the doctor seemed to think I was having more of a anxiety attack, so they put me in a regular room.
Mm-hmm.
But the nurse came in and took one look at me and said, she needs to be in intensive care right now. So she got the doctor up there and she told him that. And I think she saved my life.
What do you think some things that would be different in a third world country compared to the U.S.?
Technology, modern buildings.
For sure.
We go over there for lack of doctors and poor people that can't afford care. So our doctors and nurses go over there and give them free medical care.
Do you think your financial stability would have something to do with the way you're treated over there?
Possibly.
Do you have any recommendations for future nurses?
Well, I hope we have more of them because I think there's a shortage. So,
do you have any recommendations for the way they should treat patients?
Yeah, they should have a lot of patience with them and be cheerful and be there when they, check on you often. And
Yeah, a lot of times they'll forget to come check on their patients. How do you feel about that?
well, that's not good.
Yeah.
Because, you ring the bell
Mm-hmm.
and they don't come and they don't come and they don't come. So,
All right. Well, thank you for your time.
you're welcome.